Okay, so again, appendicular skeleton always have a girdle. Okay, and we did the upper, and that was the pectoral girdle. Now, the pelvic girdle is attached to one structure, which is going to be the pelvic bone. And later on, we're going to see that that pelvic bone is actually made out of three bones. The pelvic girdle, another name for that is called the coxal bones. The hip bones, they're united anteriorly with each other. So they have connection anteriorly, but in the posterior part of the hip bone, they're actually connected through what we call the sacrum. Remember, the sacrum is not part of the appendicular skeleton. The sacrum is part of the vertebral column. But that's the one that actually connects the two hip bones from the back. Now, the bony pelvis, it actually like a deep basin-like structure. And inside that basin-like structure is the pelvic cavity. So there's actually structures inside the pelvic cavity, such as the female uterus, urinary bladder, the rectum. So they're located inside that basin. It's formed by the coxal bones, okay, in which it's actually made out of three bones: the pubic bone, the ischium, and the iliac bone. So those are the three components of that bone. And then connected to the back through what we call the sacrum, but at the end of the sacrum is actually the coccyx. Okay, so this is actually what the bony pelvis looks like. Now, this is the picture of the bony pelvis. So if you take a look at it, it's actually made out of three bones. So I'm going to take one of that pelvic bone. Okay, so one half of that pelvic bone is this bone right here. And the three bones that are connected is the ilium. The structure looks like a wing, okay? It looks like flaring from the upper part of the pelvic bone. And then the pubic bone, that's one goes superiorly on top of the pelvic bone. And the ischium is the one located below the pelvic bone. So these three bones are actually not fused when the baby is born. Remember, the baby cannot walk when they're born because the three bones are not fused. So when it starts to fuse, somehow about 7 months to 8 months, the baby starts to walk. And that's because now the bone is now fused, so it's stable for the baby to walk. They call it a coxal bone. It's also called the os coxae. It's also called the hip bone. Those are the three terminologies that we use for that pelvic bone. So that is going to be one with pelvic bone. Now, the other pelvic bone is located here, and if you notice, anteriorly, they're connected through this part here, anteriorly by the pubic bone, and we call it the symphysis pubis. The symphysis pubis is a connection between the pubic bone anteriorly. But if you take a look at the posterior pelvic bone, they're actually connected through this vertebral body that is going to be the sacrum. So if you take a look at the structure that's located here, you want to see where that lower extremity is going to be articulating, and that should be around this area, which is a depression called the acetabulum. So acetabulum is a depression located at the lateral side of the pelvic bone. So the articulation in that area is through the head of the femur. And remember, this is similar to the articulation of the upper extremity, which is the humerus head, into the glenoid cavity. Now, the structures that you would see that it is located here, okay, it's actually called the foramen. So you have a cavity or a hole that exists between the pubic bone and the ischium, and that is going to be called your obturator foramen. All right, so, but basically the best way to actually look at the pelvic bone is look at it on a half bone. And that's going to be the structures that we're going to be looking at and identifying them and use it as a half bone. So first of all, let's take a look at what specific structures are supposed to be seen on the coxal bone. So we stated that it's made of the ilium, ischium, and the pubis. And then that is going to be fused on adulthood, but still they retain separate names to the regions of the coxal bones. Even though they're fused, okay, we actually tell them as a coxal bone, but there are actually three regions that area because it used to be unfused, okay, in childhood. So acetabulum, as I mentioned, is actually the area in which there's a deep hemispherical socket on the lateral pelvic surface. This is where your head of the femur articulates. And that's going to be the acetabulum. Now, for the ilium, so you know that the ilium is a flaric bone located superiorly of the pelvic bone. So it's a site of attachment for many of the muscles. It articulates with the sacrum medially, posteriorly, and that articulation is called the sacral iliac joint. Now, the ischium is actually formed posterior-inferior region of the coxal bone. This part here is located the posterior inferior region. That's the reason why we have this tuberosity called the ischial tuberosity. And that's actually the strongest part of the hip bone because that's the one that you sit on. If you have somebody sit in your lap, the bone that you feel on your lap is going to be the ischial tuberosity. If you take a look at the ischium, anteriorly it joins the pubis anteriorly. So that's the association of the pubis with the ischium. Now, last of that is going to be the pubis. That's location, anterior region of the coxal bone, and also lands horizontally in anatomical position. It's a horizontal bone at the anterior portion. Now, the two pubic bones from each of the pelvic bone is actually connected in the middle to the pubic symphyses. The connection of that is going to be fibrocartilage. They locate that fibrocartilage to the midline. And then this is what a pelvic bone looks like. Remember, these are one of the pelvic bone. There's two of them, and we have to identify the structures here based on its orientation. So the first thing I'm going to be looking at is actually where is the acetabulum. So the acetabulum tells me this is where the head of the femur will articulate. So this part here that I see right on this picture is actually on the lateral view because femur is going to be on the lateral side of the pelvic bone. So that's going to be my landmark identifying where is the orientation of this bone. That's going to be the lateral view. Now, the medial view, so the medial view is going to be the area here that is rough. This part here is where the sacrum used to be. So the sacrum used to be in this area back here. So that's the reason why it actually becomes a little bit like rough on that area because we removed the sacrum. So when you see that, this is going to be the landmark that I'm looking at. This portion here of the part of the pelvic bone in the medial view, that's going to be the auricular surface, which is exactly where the sacrum articulates with the pelvic bone. So anything that I see on this area back here, I'm at the medial view. If I see it visibly, I'm looking at the medial view of the pelvic bone. And again, I have lateral, I have medial. I want to see where's my superior and inferior is located at. The crest, the sharp portion that's located on top of the ilium is going to be the iliac crest. So the iliac crest is the area saying that this will be superior. So always remember, orient yourself to anatomical structures so that you can identify what are you looking at. And then this part here that has this rough part at the bottom, that's going to be the ischium. And that rough part is called the ischial tuberosity. Remember, that's the one that you sit on. So you know that's the one you sit on. So this part here is going to be the inferior view. So now we orient ourselves, which is going to be the medial, the lateral, the superior, and inferior. Now we need to actually identify again, which is going to be by interior. So the part here where the sacrum used to be, that is by posterior. Okay. Now, if you note, there's a lot of names that we actually referring to when we identify those bone markings. We got the anterior superior iliac spine. We got a posterior superior iliac spine. That's the reason why I have to orient yourself. Opposite to this is going to be the area, the anterior. So now we have the anterior and posterior by looking at the medial view. Now for the part here again, that is going to be of the lateral view. You notice that instead of a fossa, iliac fossa, which is the depression, But on the lateral view, you got something that looks like a wing. That's the reason why they call it allay. Allay means wing. If I look at that, and I'm looking at this part here of the pubic bone, this is anterior, and this is posterior. And my iliac crest is superior. This is the iliac crest, that's going to be superior. And the ischium, with the ischium tuberosity, this is inferior. So I've actually now identified my structures on orientation. Now, there's going to be a spine that I need to identify on this picture. The spine are sharp projections. So I have my orientation, and I'm going to actually do the spines. So the next thing I'm going to be identifying are spines. Now, this part here, located the interior of the iliac bone, because I'm located here, the iliac bone. Anything above here is iliac. So the spine that I'm putting here, that's going to be my anterior superior iliac spine. Just remember the name. It tells you the location. It is in the front above, and it's in the iliac bone. It is a spine. That's the reason why I call it anterior superior iliac spine. Sometimes it's easy to actually memorize it as ASIS. There's another one at the bottom of the iliac bone at the anterior view. That is going to be my anterior inferior iliac spine, still at the iliac bone. So I'm going to use the word AIIS. So I'm finished with the spine on the anterior part of the iliac bone. I'm going to take a look at the spine on the posterior part of the iliac bone. This is posterior spine on the iliac bone. Again, this is also the posterior of the iliac bone spine. Since this is superior, I'm going to call it posterior superior iliac spine. That's called PSIS. Now, there's another spine below that. Since it's located inferiorly and posteriorly, I'm going to call it the posterior inferior iliac spine, or PIIS. And then the same place here, this is going to be my posterior inferior iliac spine. So now I've noted 4 spines at my iliac bone. So those are the spines that I need to identify on this pelvic bone. We're going to go down into the ischium. There's another spine on the ischium located at the posterior portion of the ischium. So this part here, located at the ischium, purple structure are all ischium. This is my ischial spine. Since the spine is located at the ischium, I'm going to call it the ischial spine. And there's only one of that. So now, take a look at the notch. The notch that you see above the ischial spine that is actually deeper, that is called the greater sciatic notch. The word is sciatic, so that means that the sciatic nerve passes through that notch. And you can also see it between the posterior inferior iliac spine and the ischial spine. Now let's actually continue on. Okay, so we have the greater sciatic notch on top, and the lesser sciatic notch is going to be below. So lesser sciatic notch is below the ischial spine. So we're actually just looking at bone markings, the notch. Now, between the two bones, the ischium and the pubic bone, there's going to be a hole called the obturator foramen. Now, the obturator foramen is actually a place where the nerve passes through there, called the obturator nerve. And the obturator nerve, you will see it later on once we see the muscle, it's actually innervating the adductor muscles on that area. That's actually a hole between your pubis and ischium. Remember, the hole is created only by the pubic bone and the ischium. It's not actually created by the ilium, because the ilium is superiorly located. All right, so generally, those are the most important things that you have to understand about the pelvic bone. So the pelvic bone is actually the bone. It's made out of 2 parts connected to the front by the pubic bone, but it is connected to the back by the sacrum. So let's take a look at this information about what is a true pelvis and a false pelvis. So true pelvis and false pelvis is actually a location within that pelvic cavity. So the false pelvis is bounded by the alley of the iliac bone. And the true pelvis is bounded by what we call the below the pelvic brim. So let's take a look at that pelvic bone in this part. Remember, this is the iliac bone. And this is going to be the pubis, and this is the ischium. So iliac is above. Now, if I actually put a line, an imaginary line, okay, that goes out from here at the alley of the iliac bone and goes around the pubic bone, and remember that continues on to the other pelvic bone, that is called the pelvic brim. Pelvic brim is an imaginary line that we created from this portion here, and anything above that is called the false pelvis, and anything below that, the pelvic brim, that is called the true pelvis. What is this importance? So to know what is a true false pelvis and a true pelvis. Now remember, the baby's head starts out this place right here. So when somebody is pregnant, the baby's head actually is just located above on the pelvic brim. In order for the baby to be delivered, the baby has to descend down into the true pelvis. So there's other differences between a male and female pelvic bone. So pelvic structures in childbearing. The pelvis is lighter, wider, and shallower than in the male, and it provides room in the true pelvis. So if you notice, the female sacral bone is actually going outward. Compared to the male is actually protruding inward. There should be no room for the baby to go through in a male pelvic cavity. So that is impossible. No matter what, males cannot actually carry babies because of their anatomical structures. Another thing is, if you take a look at the inside of the pelvic cavity, male's pelvic cavity is heart-shaped. Now, if you notice that the cavity is narrow compared to the female cavity, which is wider. So anatomically, males cannot carry babies. So that's actually the difference between male and female pelvic bones. So now we finished with the pelvic bone. Now let's take a look at the lower limbs now. So the continuation of the pelvic bone to the lower extremity is going to be the lower limbs. So the lower limbs carries the entire weight of the erect body. Its bones of the lower limb, they're thicker and stronger compared to the upper limb. But just remember, the architecture is quite similar. You actually realize that they look similar to the upper limb. So it's divided in three segments: the thigh bone, the leg bone, and a foot. The thigh bone is actually made out of your femur. The leg bone is actually made out of your tibia and fibula. And the foot is made out of the tarsals, metatarsal, and the phalanges, the toes. Now, if you take a look at the architecture of the upper limb, they're similar. The thigh bone is one bone, and the upper extremity, the arm also has one bone, which is going to be the humerus. Then if you take a look at the leg, it's going to be the forearm of the upper extremity, and it's also made out of two bones, the radius and the ulna. And then the ankle bones are called tarsal, the foot. We also have that on the hand, carpal. And then metatarsal is covering the web of your foot. We also have that on the palms. We call it metacarpals. And then the phalanges, or the digits, we also name that the phalanges also. So most of the structure that you see on the upper extremity is actually similar to the lower extremity. And that's the reason why when we started, we said architecture are going to be similar. So let's actually take a look now at the thigh bone. It's actually the region of the lower limb between the hip and the knee. The bone is called the femur. It's single bone in the thigh. It's the longest and strongest bone of the body. That's going to be your femur. The head is ball-shaped, and it articulates with the acetabulum. Now, this is the structures that you see on the femur. Remember, whenever we study anatomy, you should find some landmarks that you can actually identify if you're looking at the anterior, posterior, medial, lateral. That's always a requirement. And that's the reason why we actually did the lecture called body orientation, because we have to identify this structure and determine if I'm looking at the proximal, distal, medial, lateral, and then anterior and posterior. So in this case, since we're actually looking at it as in a longitudinal axis at the point of attachment to the pelvic bone, we cannot use the word superior and inferior in this case. So anything that you see here on top, these are your proximal. Then anything that's located here below, that's your distal. And this is the mid shaft. Okay, so these are the terminology that we have to look at in order to actually determine orientation. So let's do our orientation first. What's going to be my landmark where the proximal is? That's going to be the head of the femur. So I know if I see the head, that's my proximal. And the wheels, take a look at this bottom portion of the femur. It looks like wheels. And remember, I said on our bone markings, when you see the word wheel, that's the term is actually a condyle. So this is going to be where the wheels are. And that's the distal. Now, we actually did proximal, distal, and we're going to identify medial, lateral. So wherever you see the head of the femur, we're pointing at the medial surface. So follow the head of the femur, we know that's the medial surface. If you're pointing at away from the head of the femur, we know that's the lateral surface, lateral here. So the last one that we need to identify, how do I know it's anterior or posterior? Now, we're going to do a landmark. So whenever we identified your bone, you have to find a landmark in order to identify. So if you go and look at the distal end, you see at the distal end here, it's actually a depression. So whenever you have this depression, we're going to call it a fossa. Now take a look at this part here, the anterior view. There's no depression there. And we call it a surface. And that is called the patellar surface where the patella sits. But at the posterior view, there's a depression between the two wheels called condyles. So this part here is called the fossa. And this, since it is between the two condyles, I'm going to term that intercondylar fossa. The word inter means between. So just terminology. So between the two condyles is going to be the intercondylar fossa. So now I note that this is posterior view and this is anterior view. So that's actually now our orientation space. Like anterior, posterior, medial, lateral, proximal, and distal. So I'm able to identify now the structure. So I'm going to start with the structures located at the proximal end of the femur. So I'm going to change that color into green so it has a different labels. So if I look at the proximal end, the first thing I see is actually the head of the femur. And there's a hole located there at the head of the femur. We call it a fovea capitis. The fovea capitis, you can see that it's actually a hole located there at the head of the femur. And then after that, you have the long neck. This is called the neck of the femur. Now, remember in our anatomical humerus, we have two necks in that humerus. We have the anatomical neck and the surgical neck. But here we only have one. So there's only one neck of the femur. And then after that, we have this bulge called projections. So you've actually noticed there's actually one that is above. It's a projection. And there's one below. It's another projection. So we're going to call that bulge greater trochanter. And at the bottom, we're going to call it the lesser trochanter. Let's go back to the humerus. Remember, we had the same thing on the humerus. So in the humerus, instead of calling it the greater trochanter, we actually called it the greater tubercle. So if I ask you and tell me I have about 5 bones in front of you, I'm going to ask you which of this has the greater tubercle. Now, you cannot say femur because the femur has the greater trochanter. So the greater tubercle is actually seen at your humerus. So again, our architectures are the same. So this part here that connects the two trochanters, It is between the trochanters, so I'm going to use the word inter, and it's sharp, so I'm going to call it intertrochanteric crest. And remember, on the humerus, we have the same thing. We call it intertubercular line. Since it's not bulging, we just call it a line. Here, it is bulging, so we call it a crest. So again, that's another thing that is similar to the humerus. And then after that, you can actually note that everything in the middle is going to be the midshaft. Now, go a little bit close to the upper part of the midshaft, which is going to be the proximal end of the midshaft. We'd actually notice that there's a bulge onto the lateral posterior part of that midshaft. And that bulge is actually where the gluteal muscles attaches to or inserts. So I'm going to call that bulge gluteal tuberosity. And remember, again, on the humerus, we have similar bulge located at the humerus, at that same approximate location. And that bulge was the deltoid tuberosity. So from there, we're going to go down to the distal end. But before you continue on to the distal end, there's actually something that's sharp located here at the back end, the posterior view of the midshaft. In that sharp part that is located here, that's called the linea aspera. The interior surface of the femur is round, but the posterior one is sharp. And that sharp part is called the linea aspera. Now let's follow through the distal. So we're actually moving to the distal end now. I'm going to actually concentrate on this part here on the distal end. Now remember, there's two wheels located at the distal end. So I'm going to call them lateral condyles. So I'm going to call them condyles because it's actually at it looks like a wheel. But remember, the word lateral means it's away from the head of the femur. And then this part here is going to be the medial condyle. It's actually towards the head of the femur, lateral medial. But if you actually want to actually determine, like for example, what if you don't know where the head of the femur is? So the picture is actually just this picture here. So how would you know who's medial and lateral? So the way to understand it is actually visually look at this part here of the part of the terminal portion or distal portion of the bone of the femur. You know, it's a femur because you have two wheels. Now, if you take a look at the medial part of the femur, this part here is a little bit bigger and protruding more to the edge compared to this part. It's actually not. It's actually a little bit flatter. So that's where identification of who's on the medial, who's on the lateral. So this part here, that's actually a little bit protruding out to the outer portion, that is going to be my medial. So that means this is my medial condyle, and this is my lateral condyle. All right, so we have actually looked at the temporal end from the posterior view. Okay, I'm going to go and take a look at the anterior view. Okay, so now we know that from the back, this is the condyles, the wheels, and then the anterior of the anterior of this view is flat, and we will call it the patellar surface. Now, since my wheels are identified here, there's actually going to be a bump of those wheels, and those bumps are actually called epicondyle. What does epicondyle mean? Epi means above the condyle. So the bump above the condyle, these are my condyles, the wheels, I'm going to call it medial epicondyle. And again, if you take a look at the part here, the distal end of the femur, it's a little bit thicker and protruding more to the side. So I know that's medial. So since it's above the condyle, I'm going to call it the medial epicondyle. The other part here on the opposite side, there's another bump there, and that is above the condyles. Since I'm located at the lateral side, I'm going to call this bump here the lateral epicondyle. The last part that you need to identify in this paper is actually this bump above the medial epicondyle. That bump above the medial epicondyle is actually a tubercle where the muscles called the adductor muscles inserts. In that bump above the medial epicondyle is called the adductor tubercle. All right, so we've finished with all the things we have to identify the femur, and then we are moving on. Study this and orient yourself. My landmark here is that fossa located at the terminal end. If I see that fossa called intercondylar fossa, this is my posterior view. All right, so the next bone is going to be a patella. It's actually a triangular, and we call it sesamoid bone because it actually looks small like a seed, but it's actually bigger than a seed. And remember, this actually have tendons attached to the patella to the quadriceps muscle. So once we go to the muscle, you can actually see that the quads are inserted into this patella. But the main purpose of the patella is to protect the knee anteriorly and also improves the leverage of the thigh muscles across the knee. The leg has two bones. The bones are called tibia and fibula. This is between the knee and the ankle bone. So tibia receives the weight of the body from the femur, but the fibula is just a stick-like lateral bone to the leg. So it doesn't actually carry any the weight. And then if you take a look at the tibia and fibula, there's actually an interosseous membrane, like a skin that covers between the two portions of the bone. Okay, we'll see that later on. So the tibia articulates with the femur, and that therefore forms the knee joint. The tibia also articulates with the talus at the inferior end. Talus is actually the ankle bone. Then the fibula, it does not contribute to the knee joint, but the only thing it does, it stabilizes the ankle joint. Not much of any weight-bearing function of the fibula. It's just to the side of the tibia. So this is what the tibia and fibula looks like. Okay, tibia and fibula. Now, take a look at these bones. The bones that you see here, the bigger portion is the tibia, and the fibula is actually a small bone to the side. So that means that the fibula is actually on the lateral side of the leg. So opposite to that is going to be the medial part of the leg. And then my proximal part of the leg, that's the one that has this big bulge that articulates with the femur. So this is going to be proximal. And the distal end of that is going to be the smaller, narrower bones at the two bones. So this is distal. In order for us to identify who's anterior or posterior, I'm going to use the tibia, and you've noticed that the tibia has a bump here on the front. So this bump is actually where the patella with its ligament attaches to. So that bump is called the tibial tuberosity. Remember, that is actually similar to the radial tuberosity that we saw in the upper extremities. It's actually similar. So this is going to be at the area of the tibia, the tibial tuberosity. So that's what you see here at the proximal end. So that also is the reason how you can identify who's anterior and posterior. Now, the lateral side of the fibula has the head on top, and that's actually the structure that you see at the proximal end of the fibula. Now, let's take a look at the top portion of the tibia. In the top portion of the tibia, remember, at the bottom of that, it also has a condyle. It has wheels. So these are your condyles. There's wheels at the bottom. So this part is the medial condyle of the tibia. And then this part here is the lateral condyle of the tibia. But if you take a look at the upper portion of the tibia, it's like a depression on both sides, on the superior portion. So this is where the condyles of the femur articulates with the articular surface of the condyles of the tibia. So when you say this part here, this is just the articular surface that is of the medial condyle. See, and this is your medial condyle. So the top portion is the articular surface of the medial condyle. So you cannot say that is also the medial condyle, but it is the articular surface of the medial condyle. And this part here, it's actually located close to the fibula. That's going to be the articular surface of the lateral condyle. But remember, the condyles are actually the one below. And then in between them is going to be these bumps, sharp bumps in between the articular surfaces. This is called intercondylar. Remember, between the condyle, it's protruding, so it's eminence. So it's called intercondylar eminence. So that's the one that you see in the mid portion of the auricular surface of the tibia. So nothing much that you can actually see between the part here of your mid shaft. But if you notice, the tibia and the fibula are attached to each other. And that membrane is called the interosseous membrane. And again, we also see that between the radius and the ulna. We have the interosseous membrane. Okay. Now the distal end. Okay. So if you take a look at the distal end, it has this bump here that you see at the distal end of the tibia and the fibula. And if you take a look at the bump, it actually creates this letter U. See that letter U? So we have similar structure that we saw on the radius and ulna. Remember, it actually creates a letter U so that your hand can actually glide through that letter U of the distal end of the radius and ulna. And the bumps that we actually identified between the radius and ulna, we call it styloid process. But at the distal end of the tibia and fibula, we call it malleolus, okay, because they're bigger. So the malleolus is at the distal end. Now, we have the lateral malleolus part of the fibula, and then we have the medial malleolus, which is part of the tibia. All right, so that creates the letter U again at the tip, and that's similar to what we saw on the tip of the radius and ulna, okay? So we've actually finished with these bones. Now we're going to move on to the foot. This is actually our last part of the lower appendicular. So the foot composed of the tarsals, the metatarsals, and the phalanges, okay, the three parts. So important function of the foot is supports the body weight. It also acts as a lever to propel our body forward when you're walking. So when you're walking, you notice that you actually step. So that's actually because of the foot. And then we have the segmented portion of the foot, which is pliable and adapted to uneven ground. So that's actually the importance of what a foot is. It's not flat. That's the reason why people with flat feet has a problem on uneven ground. They're not able to grab onto the floor or to the bottom. So our foot actually has a curve, so it can actually grab on uneven ground. So now this is going to be the first bone, the tarsus, okay? The tarsus is the posterior half of the bone, and there's 7 bones called tarsals. Remember, in the wrist, there's 8 carpals. There's 8 carpals. But on the foot, there's only 7 tarsals. So it's 7 tarsals. The most important part of those tarsals is the one that actually holds on to the tibia. That's called the talus. And then it holds on to the heel of your foot. That's called the calcaneus. So these are the basic 2 bones that are important in the body weight of the body, trying to carry the body weight. So the metatarsus consists of small 5 long bones called metatarsus. And remember, the great toe has the first metatarsal bone. We call it 1, 2, 3, 4, 5. So you go from big toe down to the small toe, okay? So big toe is 1. That's your metatarsal bone 1. And we call that big toe called hallux. And the first metatarsal supports the body weight. Okay? You'll see it later on that your first metatarsal is literally the one that supports your body weight. And take a look at the phalanges of the toes, 14 of them. Okay, there's 3 on each except for the big toe. It has only 2. The other ones has 3. So we call it proximal, middle, and distal. So take a look at the structure now. So we're going to concentrate ourselves with the tarsals. So the bone that's called the ankle bone, this part here is called the hallux. So this whole part here. The bottom portion of that is going to be called the heel bone, and that bone is called calcaneus. So those are the first 2 tarsal bones. And then after that, there's 5 of them here. 1 in the middle, and then 4 at the distal end. Now, if you take a look at the one in the middle, It looks like a single belly button. That's why we call it navicular. Navel means belly button. So we call that bone navicular. And the four bones here, the three bones have similar names, and it depends on the location. Since this is on the medial side, remember, if you see the big toe, your big toe is always medial. So the first bone, bone of the distal end of the tarsal is going to be the medial cuneiform. It's just location. And then the middle part here is called the intermediate cuneiform. And then the last here is going to be the lateral cuneiform. And the last of that four, which is on the lateral side, that's called the cuboid. After the tarsals, these are metatarsal 1, metatarsal 2, metatarsal 3, 4, and 5. And then we have the phalanges, only 2 on the big toe. We have proximal and distal. And the rest of the small digits of the toes are 3. We call it proximal, middle, and distal, the same way that we called our fingers. Proximal phalange, middle phalange, and distal phalanges. Now let's take a look at this side view. Talus is the one on top. That's your ankle bone. And the bottom is called the heel bone, and that's going to be called your calcaneus. And then you have the medial side. So I'm looking at big toe because I only have 2. So if I see the big toe, I know I'm looking at the medial view. Okay, so after this talus and the calcaneus, I can see the single one in the middle called the navicular. Okay, and the cuneiforms goes to the big toe. You got the medial cuneiform. The next one is intermediate cuneiform. The lateral cuneiform is not seen on this view, and the cuboid not seen on this view. And then this is going to be the first metatarsal and the rest. Second and third, fourth and fifth is located onto the opposite side. Now we're looking at the lateral side now, which is the opposite side. We still have the talus, and then we have the calcaneus, and a single bone in the middle, navicular. And then these are my cuneiforms. Okay, the one here is medial cuneiform. It's not as visible as this view. And this is going to be the intermediate, the lateral cuneiforms, and the last is the cuboid. And then the metatarsals here, and the phalanges. Remember, 3 on each, except for the big toe, there's only 2. And let's just take a look at the arches, okay? Do you need arches on the foot? Yes, because remember, this can help you grab on uneven surface when you walk. So there's an arch between this part here. So if you don't have that arch, you actually are flat foot. So there's an arch there, so it actually stabilizes you on an even surface, and that helps out in walking. So that is what we studied, the lower limb and the pelvis. So this is actually what we actually went through. We started from the pelvic girdle, and you have the 2 pelvic bones, okay, and then the lower limb, that's actually the femur, the kneecap, which is a small sesamoid bone called the patella. The leg has the tibia and the fibula, and the foot. You got 7 tarsals, 5 metatarsals, and 14 phalanges. This is going to be the pelvic bone. So at first, okay, let's identify orientation first, okay? I see the acetabulum, so this is lateral. That's going to be a lateral view. And here, I don't see the acetabulum here, so that's going to be my medial view. And this is superior and inferior. And the pubic bone tells me this is anterior. Ischium tells me this is posterior, inferior. All right, so the first thing is the 3 bones make up the pelvic bone. And this is going to be the ilium. That's going to be the iliac bone right here. And then I have my ischium. And then I have my pubic bone, pubis. So those are the 3 bones. So we identified the lateral portion as the acetabulum. That is going to be our landmark for being identified as a lateral. This is a cavity where the head of the femur articulates.
Then I'm going to go to my iliac bone. So the sharp process on top of the iliac bone, that is going to be my iliac crest. And then the part here that is like a wing curving outward, that is called the alley, right? This part was going. Okay, and then I need to identify my spines. So since I'm at the anterior, superior, I'm going to call this ASIS, anterior superior iliac spine. And then I have my spine at the anterior, but this is inferior. That's my AIIS, okay, anterior inferior iliac spine. Now on the posterior part of the iliac bone, I got my superior, posterior, posterior, superior iliac spine, PSIS. Then spine below that, that is going to be my posterior, inferior iliac spine. Now on the ischium, I have one spine, and that's going to be my ischial spine. And if you take a look at the notch that you see on the posterior part, the bigger one is called the greater sciatic notch, and the smaller one is the lesser sciatic notch. Now, on my ischium, I have this rough part here at the posterior inferior portion. That's called the ischial tuberosity. And then I got my ramus. This is my body of the ischium. And then my pubis has two ramus. One is inferior ramus and one is superior ramus. And then on the part here, the anterior, it's still considered a sharp process on the pubic bone. We call it a pubic crest. And later on, you'll see that the inguinal ligament is going to attach to the pubic crest. So the inguinal ligament will go from the ASIS to the pubic crest. That is called the inguinal ligament. So the hole that you created between the ischium and the pubis, that is called your obturator foramen. So that's a hole that's created here at the inferior portion of the pelvic bone. Here you can see the superior iliac spine, inferior iliac spine. And then if you see this rough portion here, it means that you're in the medial view. That's where the sacrum articulates with the iliac bone. That is called the sacroiliac joint. So generally we call it the auricular surface. So those are the ones that we have to identify on this pubic bone. Next, I'm looking at the whole pelvic bone. And remember, the sacrum and the coccyx are actually not part of the pelvic bone because the sacrum is part of the vertebral column, which is part of the atrial skeleton. But where the iliac bone and the sacrum articulates, we call it sacroiliac joint. Again, this is my crest. Then on the medial surface of the iliac bone is a fossa. That is called the iliac fossa. Now, if you want to identify the spines here, you can actually also do that. So you could identify the ASIS right here. And then you're going to have one here that's going to be the AIIS, anterior inferior iliac spine. The only thing I can see that is not as visible is going to be somewhere here. That is your posterior superior iliac spine. My posterior inferior iliac spine is going to be somewhere here, PIIS. And the ischial spine is not visible very much from this view, but that is going to be my ischial spine. And generally, this notch is my greater sciatic notch. And then underneath that, which is going to be this one, is the lesser sciatic notch. And the pelvic brim, the one that you can go around, like the portion of your cup, that's called the pelvic brim. So whatever you see above is your false pelvis, and is going to be the true pelvis. And then this is actually considered as part of the arch between the two pubic bone. We call it a pubic arch. So that's what I see on this part of your anterior view. Posterior view, I see that wing called ale right here, posterior view. And then here's going to be my ASIS, anterior superior iliac spine. And then not as sharp as you see here on this view, AIIS. This is going to be my PSIS, posterior superior iliac spine, and this is my PIIS, posterior inferior iliac spine. And then this one is my ischial spine. Now this is called the greater sciatic notch. And then one below that, actually below the ischial spine, is going to be my lesser sciatic notch. Okay, and then we have this ischial tuberosity, the rough part of the inferior part of the ischium. Okay, and the whole is called the obturator foramen. That's going to be an obturator foramen. All right, so we're going down into the femur now. So again, I'm going to take a look at my orientation and my landmark. So remember, the two wheels is going to be a landmark that actually tells that this is posterior view, the distal portion. And then remember, those are wheels, so we call it lateral condyle. Away from the head is lateral condyle, so this is lateral. This is medial. And this is going to be proximal. And this is distal. So the two wheels are called condyle. Then in between the two condyles, we call it the fossa. We call it between the condyle, intercondylar fossa. And then the bump you see on the side of the condyles, we're going to call it the lateral epicondyle for this part. And this is going to be the medial epicondyle on this. And then if you notice that the medial epicondyle is actually bigger than the lateral epicondyle. Lateral epicondyle is just a little bit round. Now, above the medial epicondyle is another bump or process called the adductor tubercle. That's on the medial side. Remember, the upper extremity don't have that. Okay, so we only see it on the lower extremity, on the femur. Humerus does not have that. So after distal, I want to see the interior of the distal. I have this flat surface that is called the patellar surface. That's where the patella articulates with the femur. And I have my condyles, lateral condyle away from the head, medial condyle towards the head, and the epicondyles, the bump above the condyle, lateral epicondyle, and medial epicondyle. And then I have a small adductor tubercle on top of the medial epicondyle. So those are distal portion. Mid-shaft, I don't see anything on the mid-shaft, but on the proximal, a little bit lower than the proximal portion of the humerus, there's going to be a bump to the side of the femur. This is called the gluteal tuberosity. Gluteal muscles inserts into that tuberosity. And then I'm going to the proximal portion. I have the head and the neck. It looks extended more on the femur compared to the humerus. And then I got my two bumps. Those are my trochanters. In the humerus, it's called tubercles. Okay, I got the crater trochanter that is superior, more above, compared to the lesser trochanter that is below. Again, greater trochanter, lesser trochanter. In between is a sharp bone marking called the intertrochanteric crest between the trochanters. But on the anterior view, it's just a small ridge, and that's called the intertrochanteric line. And I forgot to mention to you that the part of the posterior view, this part here is sharp. And that's called the linea aspera. You only see that on the posterior view. And that's how you identify the anterior and the posterior. So that linear aspera is how you identify who's the anterior and posterior. Okay, the linear aspera, you can feel it's sharp. Okay, but the anterior view is round here. It's rounder on the anterior part of the femur. So to finish with that part of the femur, now let's go to the proximal, more concentrated on that one. Okay, so I'm going to start here, head of the humerus, and this hole where a blood vessel enters there is called the fovea capitis. It's like a hole where blood vessels enter into the femur. So the head, and then I have a neck, and I have the trochanter, greater trochanter, lesser trochanter, and a crest. So I see a crest, so that's going to be my medial view. So I'm looking at the tilted on the medial side. And the trochanter crest, intertrochanter crest on the posterior view here. And then you can also see a line in the between the trochanters. That's going to be intertrochanteric line. That means anterior view. And here's going to be your gluteal tuberosity on the lateral side, more proximal, a little bit lower. All right, so that was on your proximal. Now I got my distal view. I got the two condyles, the two wheels. Okay, now I don't see my head, so you're gonna actually say, how would I know who's medial and lateral? As I said, the medial part of the distal end of the femur has more protrusion than the lateral part. Even if I don't see the head, I can actually identify who's medial and lateral. The medial side is more protruding bone marking here, and that's going to be the medial condyle, and a little bit rounder onto the surface here on the lateral side, that's lateral condyle, and a bump above the lateral epicondyle, and then here's the medial epicondyle, and then a small bump above the medial epicondyle, that's going to be your adductor tubercle. Again, I'm at the anterior view because I have a flat surface in the portion here at the distal end, that's called the patellar surface. Again, I don't see the head of the femur, so I'm going to be able to, but I still can be able to see medial and lateral. The medial distal end of the femur has more protrusion compared to the lateral distal end. So this is going to be my lateral condyle, this is medial condyle. The bumps here on the medial side, medial epicondyle. Epi means above the condyle. And this is my lateral epicondyle. And then the adductor tubercle is only seen on the medial side of the distal end. That's called adductor tubercle. So we finish with the proximal distal end of femur. So from the femur, we go now to the leg. So the leg has two bones, tibia and fibula. And always remember, the fibula is always on the lateral side. And the tibia, which is the shin bone, it's on the medial side. All right, so this is proximal of the two bones, and this is distal. And again, I want to identify anterior, posterior in this case. I'm using this bump here onto the proximal part of the tibia. That is called the tibial tuberosity. So if I see that, this is anterior view. Now, the bone that articulates with the femur generally is just the tibia. The fibula is just on the side. So the tibia has condyles also similar to the femur. So this is lateral condyle, and this is medial condyle tibia. Now, if you go to the posterior surface, this is posterior view because I don't see a tibial tuberosity. This flat portion here is the articular surface of the medial condyle, and this is the articular surface of the lateral condyle. And these are called the eminence between the condyles, intercondylar eminence. So on to the fibula, the only thing I see there is going to be the head of the fibula. So going down tibia and fibula, there's nothing that is prominent onto the mid shaft. And then once you go distal, tibia has this bone marking called the medial malleolus. And then onto the distal end of the fibula, it has also a bone marking. That is going to be the lateral malleolus. That is going to be similar to the medial styloid process. and the lateral stylar process of the humerus. Okay, and then the joints between the tibia and fibula and distal end, that's called the distal tibiofibular joint, and the joint between the proximal portion of the tibia and fibula, that is called the proximal tibiofibular joint. All right, let's take a look now at this part here, and this is going to be your the proximal end, and I'm going to take a look at my proximal end of the tibia. I see the tibial tuberosity, so that's going to be my anterior view. Here is the posterior view. I don't see tibial tuberosity here. And if you take a note, where's my lateral and medial condyle? Now, if you take a little bit look at the medial part, it's more protrusion on the medial part compared to the lateral part. So this is lateral condyle, and this is medial condyle. This is lateral condyle, and this is medial condyle. So that is my intercondylar prominent eminence. Okay, so I'm moving down into the next part of the tibia. Okay, and look at the distal portion, but this is actually the patella. This is the right tibia cross section of the superior surface where the articular surface are. That's where the articulation is located at. So that is the proximal portion of the tibia. And then again, this is my posterior view of the tibia. This is the posterior view of the tibia and fibula. So again, medial condyle, more protrusion, less onto the lateral condyle. And here is going to be the medial malleolus. You know, it's actually the medial malleolus because the tibia is bigger, and the lateral malleolus, the fibula, is actually thinner. So this is on the distal end. And I'm going to go now. After this tibia and fibula, I got my foot. Okay. So I'm looking at the superior surface. The first bone is called the talus. That's the one that carries the tibia. And that's called the ankle bone. Then the one on the bottom of the talus, that's going to be your calcaneus. That's going to be your heel bone. And then going forward, you see just one bone in the middle, like a belly button. That is called the navicular, or the navel, navicular. And then I got 4 after that. And remember, I found the big toe. The big toe is medial. And I got 3 cuneiforms in that area. So this is medial cuneiform, intermediate cuneiform, and lateral cuneiform. And on the small toe, to the lateral side, that is going to be the cuboid. It looks like a cube. And then I got metatarsal 1, 2, 3, 4, and 5. Number 1 is also the big toe, and you know that the big toe has only 2 phalanges, proximal and distal. The other toes has 3 phalanges. You got a proximal phalanx, middle phalanx, and distal phalanx. That is for the toes. And here I'm looking at the sole of the, I'm actually looking at the sole of the foot, okay? The inferior portion of the foot, the plantar surface. Now, since I'm looking at the plantar surface, I'm looking at the calcaneus bone here. And one on top that is going to be the talus. So now I identified the one that it looks like a belly button, single one in the middle. Remember, we're looking at the bottom view, the sole of the foot. That's your navicular. And then this one is with the first metatarsal, where the big toe is. So that is called medial cuneiform. And then this one is intermediate cuneiform, so it's not as big as from the surface superior view. That's intermediate cuneiform, and this is going to be the lateral cuneiform. And the last one is going to be the cuboid. So this is metatarsal 1, 2, 3, 4, and 5. And then the phalanges, big toe 2 only, proximal distal. The other toes are going to be proximal, intermediate, and distal. So that is on the foot. Lateral. Now looking at onto the different side view. So I'm looking at the medial view. So this is your calcaneus. This is your talus. Now on this side, on the medial view, I know this is my big toe. There's 2 of them. This is the hallux or the big toe. So what I'm looking now is here called the medial cuneiform. This is the navicular. And then after the medial, intermediate. I don't see the lateral cuneiforms here. Now on the lateral view, I'm looking at the small toe onto the lateral side. There's 3 of them, 3 phalanges. So this part here is going to be the talus, the calcaneus, and this will be my navicular, and this is cuboid, lateral view. Beside the cuboid is the lateral cuneiform, and then the intermediate cuneiform, and I can see a little bit of the medial cuneiform here. So this is going to be onto the lateral view. So lower appendicular skeleton, okay, I'm showing you a rotational view of the pelvic bone. And you can actually see the 3 bones that is actually forming the pubic bone, the ilium. Okay, the one that's colored blue, the pubis is colored yellow, and the ischium is colored orange. Those are the 3 bones. So this is how you look at it if you have this 3D rotational view. So this shows you of the iliac bone. Okay, so this is the ilium. And then here, this is actually where the ischial tuberosity is. So that is going to be my ischium. On this part, this is actually where the 2 bones unite in front. That's going to be my pubic bone. Now, this is the acetabulum, so lateral. And then these are my spines, okay? So the spines are, this is posterior superior iliac spine, posterior inferior iliac spine. This is anterior superior iliac spine, anterior inferior iliac spine. And then this part here. Okay, so I'd rather use this one to identify the ischial spine right here. Okay, ischial spine right there. So next, okay. So this one shows you the ASIS, anterior superior iliac spine. Okay, this is posterior superior iliac spine. They line up in an angle from each other. Now, these are the spines, okay? So the first one is the AIIS, anterior inferior iliac spine, because they're looking at the iliacum. And this one is going to be the greater sciatic notch. The greater sciatic notch. So the greater sciatic notch is in between the PIIS, posterior inferior iliac spine, and the ischial spine. This one shows you the PSIS, posterior superior iliac spine. Okay, so now we're here. So this is going to be the auricular surface of the acetabulum. So the surface is around the acetabulum, and the whole is called the acetabulum. So that is what I see on this rotational view. Next. So this shows you the ischial spine, which is actually where the ischium is. Okay, so this is the ischium. So those are the structures that are seen in the ischial spine. Okay, and here is going to be part of the lesser sciatic notch, that part here. Okay, just below that ischial spine. That is called the lesser sciatic notch. Okay, now this is going to be the inferior portion of the ischium, still on bone mark of the ischium. That is a rough portion of the inferior portion. That is called the ischial tuberosity. Okay, that's the one you sit on. Right, next we have the ischial part. Remember, the obturator foramen is actually created between the ischium and the pubis. So the pubis and the ischium is the one that creates this foramen, obturator foramen. And that's actually the hole created by these two bones. Here is on the pubic bone, okay, the bump that you see here, okay, is called the pubic tubercle, okay, and that is in the pubic bone.